I can speak for my jail in a rural county, Franklin County. We're seeing a rate of 55% of individuals who are booked into our facility screened positive for opioid use disorder. And about 37.5% of those booked take advantage of our program of medications for opioid use disorder. So the prevalence is just dramatically high.
Here on the eastern part of the state, the problem is pretty bad as well. We're seeing 40 to 50% of individuals that come in at intake that require a medical detox because they are withdrawing or having symptoms of withdrawal. So this is a particularly challenging problem, and COVID has been a significant driver of that challenge in ways that we never seen. We're talking about 90% of individuals that are now coming in that have diagnosed substance use disorder or have a history of substance use. And then you layer that in with the mental illness that is also driving up the numbers within our facility, and it makes for a challenging population to work with. But at the same time, this is work that has to be done, because you shouldn't have to come to jail to get these services, to get treatment and care coordination. But while you're here, it's a window of opportunity. And I'm sure Ed in Franklin County feels the same way, that this is a window of opportunity for these folks to be evaluated for probably the first time in their lives, potentially, and then to access treatment also for one of the first times in their lives. Here in Massachusetts, we're really lucky because we've got a very high rate of health insurance for the general population, the general community. Approximately 4% of individuals in Massachusetts are not covered by health insurance, but 24% of our populations are not covered by health insurance. So that lack of care and health care is a significant challenge for this population.
A report that the Massachusetts Department of Public Health released a few years ago showed that the risk of fatal overdose was 120 times higher for people recently released from incarceration compared to the general population. So to add to the sort of prevalence numbers that Ed and Cash mentioned, I think that high rate of risk as well is something that's really important to note when we talk about scope of the problem.